have not made a YouTube video in so long. So I did a little question box on my Instagram and I said that I would take 20 questions and answer them here on YouTube. So let's just go ahead and get right into it. What do you love most about being a hygienist? The thing that I love most about being a hygienist is that right now we are truly at the forefront of medical dental integration, which is so exciting. There is so much room for advancing our profession and elevating what we do as mid-level providers. You know, you hear of things like hygienists working in nursing homes, hospitals, schools, and things like that. We are just at the beginning of medical dental integration, and a huge part of that is getting hygienists into these areas where they might not have been before, in OB/GYN offices, you know, being lactation consultants. There is just so many places for us to go, and that is extremely exciting about being a hygienist. I love prevention and I love educating patients on things that can happen before they actually happen. I love prevention and I love the opportunities that are available to us and what the future looks like for dental hygienists. How do you set an hourly wage when applying for your first dental hygiene job? Love you. First of all, love you too, Lori. Start by getting on Indeed early and signing up for the emails that come in when new job listings are going up. Get familiar with what is being offered in your area. Every state, every city is different. Do a little work, a little research on what is being offered. Ask your professors. You can also go on Facebook group pages and you can post anonymously and ask what is being offered, but make sure you do this before you get to the interview. Don't wait the day before to scramble and try to come up with a number. Put a little effort into it and make sure you are looking and searching for what is being offered in your area, because what is here in my city may not be the same in yours. I can't give you a definitive answer of what a new dental hygienist should be making straight out of dental hygiene school in your area, so you will need to do a little bit of footwork, but all it takes is being on Indeed early. I would say get on there a month early before your interviewing process and just look on there every day, like what's being offered, what's the range. When you took your boards, did you think you failed? Well, I was class of 2020, so I had a really fun experience where my program got shut down. I was set to take my national board exam, and 2 weeks before the exam, it got canceled. I had studied for about 2.5 months up until that point. Then COVID hit and I completely stopped studying. And then a couple months later, I think in May, a testing site opened up in a different state. And so I studied for 4 days and then I traveled 6 hours to take the national board exam. And I was just so thankful for the opportunity to take the exam, because throughout COVID, like, we really didn't even know if we were ever going to be given that chance again. I took the exam and I felt pretty confident, but there is still that part of you that just is kind of like a pessimist and just thinks that you failed. I think that we all think that we failed at some point or another, and you replay the exam, you replay the questions. I think it's pretty normal to think that you failed the exam, honestly. If you go on Facebook group pages around the time of your boards exam, everybody will be on there saying the same thing. Like, did you get your results? I think I failed, blah, blah, blah. Like, we all kind of have the same similar thoughts. Would you become a hygienist all over again, knowing what you know now? Full transparency. I would still become a dental hygienist. I think that if I would have done it at an earlier age, I might have done something in addition to being a dental hygienist. So now that I've been practicing for a little over 3 years, I have really found that I love doing a little bit of this and a little bit of that. I like doing a bunch of different things. So clinical hygiene for me, and only doing clinical hygiene, that just isn't for me. I like to do a little bit of speaking, a little bit of writing, maybe a little bit of teaching, a little bit of content creating. That's what I love about my role as a dental hygienist. So I think that if I were to do it all again, I would have gotten smarter earlier and done it at an earlier age. And I probably would have also done something with skin, got into like dermatology or something like that, because I love the beauty industry. And I think it would be so fun to do clinical dental hygiene a few days and then be able to be in like a med spa the other days and be able to provide services like that. Knowing what I know now, I know the struggles and the disadvantages of being a dental hygienist. I've been in toxic, negative work environments and all of those things, but I love the growth that I've been able to have in dental hygiene. I love where it's going, and I love what you can create it to be. Would you want to be a dentist someday? My answer to that is no. I do not want to be a dentist. There is not any bone in my body that wants to do that. For me, my focus and my passion is behind prevention and educating patients. There's nothing in me that wants to do restorative dentistry or do cosmetic dentistry or anything like that. I mean, if anything, I could potentially think about like being a periodontist. Even that, I like I said, my passion lies behind prevention, and it is so different than being a dentist and, doing the procedures like fillings, crowns, root canals, extractions, and all those things. Like, that's just not what my passion is. My passion is, providing patients with screenings and education, oral hygiene instructions, and that is what I love to do. And I also really love to scale teeth, and just the satisfaction of actually like removing calculus. That is just where my heart is. Time management as a new grad versus now. For instance, do you still run behind? There are days where I run behind, but for the most part, I do tend to run on time pretty well now. It's been about 3 years, but it takes time and it takes practice, and that's just the fact of it. I mean, you go from 3-4 hour appointments to like a 1 hour visits, you're gonna run behind. But some of the things that you can do is limit the amount of time that you are talking to the patient when you are new. When you are new, it is so easy to lose track of time, and you start having a conversation, and by the time you know it, you're already like 20 minutes into the appointment. You can also polish first. It makes so much sense to remove all the soft stuff and be left with the hard deposits afterwards. Making templates. Have a template in your phone, in your notes, for things like a new patient appointment, a periodontal maintenance appointment, a prophy appointment, an SRP, and a child appointment. Make that in your notes so that whatever office you go into, you can take that template and you can put it right into the computer and you can fill it out. That is going to save you so much time in itself. What's your hygiene paid journey look like from starting paid till now? So I won't give you what I'm currently getting paid right now out of respect for the practice that I work for, but starting out as a new graduate straight out of dental hygiene school, I was making $47.50 with 8 years of experience as a registered dental assistant. Now, with hourly rate, I just want you to think about the things that are also included in your practice. There is so much more that goes into it than just your hourly rate. Think about the other things: benefits, PTO, how many patients you're seeing per day, what the work environment is like. Try not to get stuck on that hourly rate, because there's a lot more that you should be looking at when it comes to a hygiene position. Since starting, there has definitely been a lot of inflation because a lot of hygienists have retired and there is a shortage of dental hygienists. So hourly rate has gone up, but I think it's really important for us to understand our value and what we bring to a practice. If you are just doing the bare minimum and doing bloody prophys all day and being a prophy queen, then you should really think about how you justify that hourly rate. Why are you worth X amount? Like, what are you bringing to the practice? It's not just about going in and cleaning patients' teeth. There is so much more that we bring to a practice. If you could change one thing about dental hygiene, what would it be? If there is one thing I could change about it, it is how hard it is on your body. I wish there was some way to make it easier on your body and make it more sustainable for a long, healthy career, because let's face it, it is hard on your back, your neck, your hands, your wrists. That is the one thing that I would change. I would just wish there was some way to make our posture perfect out of the 8 hours that we are seeing patients, and just be able to make it more sustainable. How do you prevent burnout as a hygienist? If you are fortunate to not have to work 5 days a week, this is my biggest advice, especially for new graduates: don't take on too many days. I made this mistake. I've seen hygienists make it over and over again. As much as we think we can work 5 days of clinical hygiene, if you have the opportunity to work less, start with less. It is much easier to get into an office and say, I can work 3 days a week. You work 3 days a week, you figure out you want to work 4, they will be more than happy to add a 4th day and have you start seeing more patients. So it's way easier to add days than it is to commit to 5 and tell them that you can't work 5 days, so now you have to see less patients. That is my biggest advice, is to not take on too many days too quickly. What is one piece of advice you would give to someone who is going to dental hygiene school? Find that balance. Figure out a schedule that works for you. Do a little bit of what makes you happy. Of course, be invested in the dental hygiene program and do your best, but make sure you are spending time with your friends and family. You're taking care of your physical health and your mental health. Don't lose sight of taking care of yourself. Going through a dental hygiene program is extremely exhausting, both physically and mentally. It puts you through it. So just take the time to really find that balance and enjoy the process. Really enjoy the journey of learning and exploring something new, because that's really what it is all about. You're gonna fail fast and learn faster. Don't be afraid of it. Don't shy away from it. Make it your strength. How can I adjust/advice on switching offices after only working at a prophy palace? So a prophy palace is somewhere where they are only doing prophys and basically perio, gum disease is not being addressed. Do a refresher course, a continuing education course, and just get a refresher about periodontal disease. And also don't be afraid to reach out to your coworkers. If I was working with the hygienist who came from a prophy palace and they were interested in learning more about treating perio, I would be more than happy to have those conversations and come up with a periotherapy program in the office that is easily implemented by both clinicians. You want to learn the verbiage of how to explain perio to a patient and how to increase case acceptance. So utilize social media platforms, because there are people out there who are talking about, diagnosing perio and treating perio, and it can kind of just give you a new, fresh perspective. Is the pay good for dental hygienists? This varies on you, your lifestyle, your preferences, where you live, the cost of living, your responsibilities, the things that you have to pay for. It varies, right? If I say the pay is good for dental hygienists, that doesn't really apply to everybody, because we are all extremely different in the things that we need in our everyday life. Do I think the pay is good for dental hygienists? I do, but at the same time, I'm in the state of California where it's extremely expensive to live. I think the pay is good, but do I think it should be better? Yes, because it is so expensive to live here, but that might be completely different somewhere else where people live and the cost of living isn't as high and it's more sustainable. It really just depends, and the pay for dental hygienists varies so much from state to state and from city to city. It is literally it's kind of impossible to even answer that question. How do you find confidence as a new dental hygienist? Definitely build your network of people around you so that you have multiple people to ask questions and learn from. Everybody has a piece of advice or a piece of knowledge that they can share with you, and continue your education. I can't stress it enough. I remember thinking when I was done with dental hygiene school that I was done going to school. That is far from beyond the truth. Dental hygiene school will give you the base of knowledge you need in order to survive in the real world, but it won't give you everything that you need, because dentistry is constantly advancing, always getting new research, new innovations, and new technology. So continue learning, and also talk to other hygienists and learn from them. Don't be afraid to learn new things and try new things. It is so easy to shy away from something because you've never used it before, or because it's difficult to use the first time around, but force yourself to try those things that are challenging. That is part of growth, is being challenged, failing, and learning from those failures. And when new innovations come in, be interested, stay passionate and stay curious, learn about these new things that are coming out. What is that? What ingredient is that? I didn't hear about that. Tell me about that. Can you tell me more about that? I'm not familiar with it. Ask questions and just be forever curious and open to learning new insights and people's perspectives. Advice to give an RDA that wants to become a dental hygienist and further their education, but they're scared. My advice to you is to go for it. I can't tell you how long I let fear get in the way of me continuing my education and making my dreams come true. There are going to be people around you that don't believe in you and that don't want to see you succeed, but do not let that stop you. Don't let anybody else's opinions or that outside noise get in the way of your success, because only you can believe in you and get you to where you want to be. The time is going to go by no matter what you do. Whether you go for it or not, the time is still going to go by. So think about what it's going to be like in 5 years when you didn't try to become a dental hygienist, when you let fear get in the way of your future, of you reaching your goals. You have to put that fear aside. Being afraid of failure is so normal. You have to be able to face that fear and say, you know what, if I fail, so what? At least I tried. At least I gave it my all. But if you just let that fear stop you from even trying, you will look back and have so much regret. I was so afraid of following my dreams of becoming a dental hygienist, but when I said, you know what, I'm gonna go for it. I'm not gonna let fear get in the way of what I can do and what I can be. When you get through with dental hygiene school, I promise you, when you graduate and you get licensed, you will look back and you will be like, what else can I do? Where else can I go? Like, what can I do next? It will empower you so much. How do you deal with the stress of hygiene school and not dropping out? The thing that kept me going was my determination and my discipline. I was not willing to give up on my dream of being a dental hygienist. I wanted to be financially stable and I was willing to do whatever it took to get there. Of course, I was stressed. There was days that I thought like, oh, I don't know if I'm gonna be able to make it. This is so hard. I don't know if I'm gonna be able to find patients. But you have to be able to continue to be disciplined, to do your homework, to get the studying done. The way that I tried to deal with it, which I could have done a lot better, but I did try to practice self-care. So I think that having a good, healthy balance, having a schedule, going out for walks, doing things like a bubble bath or going out for your favorite dessert, whatever it is, just do the one thing that makes you feel good and learn when to step away from the books. It is okay to put it down and go for a hike or go outside or make a phone call, but just know when to take breaks. Don't let yourself get to that breaking point. Make sure when you are going through dental hygiene school that you are taking care of yourself both physically and mentally. What is one thing you would have changed about yourself as a dental hygiene student? I wish I would have enjoyed the journey even more than I did. I wish I would have documented it more. I wish I would have embraced the journey of learning and being okay with failing. I wish I would have just, dove into things a little bit harder and not been afraid of failing and taking more photos and videos. I know that sounds silly, but I don't have a lot of documentation of that journey. And going through dental hygiene school was the hardest thing that I've ever done. Really cherishing those moments. I definitely could have done a much better job of enjoying the process. In dental hygiene school, what was the one thing you struggled the most with? I will say this over and over and over again, but it was balance. I worked throughout all of dental hygiene school, so I found it extremely difficult to balance work, school, studying, friendships, my mental health, my physical health, and it was hard. I was on the go for those 2 years the entire time. I worked as a registered dental assistant and I also worked at a nighttime college teaching dental assisting, and it was just a hustle. And that was the one thing that I struggled the most with. There was times where I had mental breakdowns, where I just didn't take care of my mental health the way that I should have. And I think that I just held on to so much stress through that entire time that I think I really wish I would have balanced everything a lot more and just been really strategic when it came to my scheduling and really put in a good amount of effort to keep everything well balanced. What made you want to become an influencer? So I don't know why, I just don't think I'm an influencer. I consider myself a content creator. I create content. I don't know why. Tell me if I'm wrong, but I just don't consider myself an influencer. I wanted to become an influencer because When I was going through dental hygiene school, I was looking for somebody who struggled the way that I did. I was looking for a hygienist that I could find motivation from and inspiration from, and somebody to teach me things, somebody to be that person that I know that I can go to and ask them a question and they won't make me feel bad about it. Somebody to guide me through my journey. And there were some people out there, but it still wasn't what I was looking for. And I decided to create that. I wanted to be the very thing that I was looking for on my journey. I went through community college and it was so hard to find information on how to become a dental hygienist through community college. And I put so much work into figuring out the process. Neither of my parents went to college and I didn't even understand the process of going through college. Not even a little bit. And so that is really where my inspiration for my platform came from, is just honestly creating what it was that I was looking for and being that person that people can go to when they have a question or when they are looking for inspiration and guidance and things like that. Do you recommend going from dental assisting to dental hygiene, and why? In short form, no. If you know that you want to be a dental hygienist, I think it is worth it to just go for dental hygiene and don't take the time to become a dental assistant, start working as a dental assistant, and then start your process to becoming a dental hygienist. However, being a dental assistant gave me so much experience that I could have never gotten as a dental hygienist, and it truly is, the foundation of my experience. I spent 8 years as a registered dental assistant. There was so many things that I learned along the way, from x-rays to patient communication to restorative procedures to insurance and billing and front office and back office and everything, ordering supplies, everything. I did it all. It really came from my experience as a dental assistant, but had I known from the very beginning that I wanted to be a dental hygienist, I would have just gone for that path and not taken the time to be a dental assistant and do all those things. I would have just gone straight for dental hygiene had I known that's what I wanted to do. What is the best advice you can give to a future dental hygiene student? I want you to understand that our role as a dental hygienist is extremely valuable in healthcare. We are mid-level providers, we are prevention specialists, and we are focused on educating our patients about diseases before they happen. We are at the forefront of medical dental integration. I want you to know that you are going to have to continue your education. It doesn't stop once you're done with dental hygiene school. If you want to continue to grow as a clinician, you have to continue to learn. Network. Build a network of people around you. Build those connections. Don't be afraid to ask questions. Don't be afraid to fail. Know that this journey will be hard, but it will be worth it, and your career is what you make it. Don't base your career off of what other people say. There are tons of people that will tell you that they hate being a hygienist, and there's tons of people that will tell you that they love being a dental hygienist. Your career is what you make it, and it can be whatever you want it to be. There are so many opportunities for us in healthcare, and it is truly up to you what that looks like. I am so excited that you are becoming a dental hygienist, that you're on your journey to entering the field of dentistry, and I also want you to know that I am here for you. I am always available. You can best contact me on Instagram through DMs, and I promise you I will do whatever I can to help you along your journey. You can use me for guidance and help. I got you. I made it through all of the questions. I hope that you enjoyed this video. I know that I don't make YouTube videos very often, so let me know in the comments if you would like to see more videos like this. Much love from Brush with Britt.